We're living in trying times these days as the COVID-19 pandemic turns our world upside down. Will it ever be the same again? Hello and welcome to the Unpublished Cafe. I'm Ed Hand. We're coming to you from a remote location and practicing physical distancing to enhance safety. We're just past the 6-week mark when Canada went into lockdown as the COVID-19 virus spread throughout the country. Being sequestered in your home, possibly self-isolating from your family, can have a huge toll on your mental well-being. The economic devastation from shutting down the economy will be felt long-term. Many small business owners are just looking at throwing in the towel. All are weighing on our collective mental health. And to get some perspective on how we're being impacted, I'm pleased to be joined by Frank Graves, president and founder of Ekos Research Associates. And Frank, first off, despair can be a bit of a harsh word, but what's the difference in despair between Canadians and Americans?
Well, interestingly, we just tested using a pretty sophisticated index the same questions that our colleagues in the United States, Pew, are asking to measure what they call emotional distress or psychological distress. And I was surprised, and it looks at things like in the last week, how often have you felt lonely, anxious, had a physical response to such that you felt your heart racing, felt anxiety, despair. So it covers a broad spectrum. It's used as a clinical tool to measure depression and so forth. But we adapted it for measuring the two populations. And there are really large levels of people that are having trouble with things like sleeplessness, feeling alone, feeling anxious, even 15% having a physical response in the past week. The numbers line up very closely with the United States. So our brothers and sisters in the United States are having a worse outcome to this point in time, but the emotional impacts and the psychological distress produced by this has been fairly similar and actually quite devastating. It may be that the casualties that emanate from these levels of stress and psychological unwell-being are going to have a lasting impact, or one that will register in other ways, for example, in post-traumatic stress disorders. And to the degree they're intertwined very, very closely with the economy, it's not just fears of catching COVID, it's also fears of, will I ever see a recovery, or what am I going to do to put bread on the table? And those things coalesce to produce what economists Deaton and Case called the economics of despair, which had become the leading cause of death amongst white males in the United States before this thing happened. They were dying of opioid addictions and overdoses and so forth because they'd really given up on the economy. We'll have to watch this very closely as we come out of this. I would like to mention, though, that at some level, a certain level of stress, which is directly linked to both economic and health risks, is actually functional in the sense that it produces compliance or a willingness to stay home, to wash your hands carefully, perhaps to even wear a mask in public, or to avoid having others visit you. All of these sorts, working at home, all of those are positively correlated with some level of stress. There is a tipping point, where that stress becomes despair, and that produces lower compliance and a whole host of other problems. So we have to watch this very closely. And
well, where do you see it going then, if the trend continues?
Well, there is a fragile consensus in the country to stay home, to practice social distance, and a variety of other things, which are extremely abnormal things for human beings to be doing. There's evidence that consensus is beginning to show some line fraying. What the problem becomes that as we move from the initial period of flattening the curve, making sure our healthcare system doesn't get swamped, we now come into this kind of gray zone of partial recovery, because there's really no full recovery until we find a vaccine. And the measures which are necessary to produce a safe partial recovery are not being universally welcomed by any means. So as we move, we might add other things to the list beyond, staying home and avoiding, 6-foot range for people. we may also say, well, maybe, you're actually going to have a test. And if you're positive, you're going to have to download an app and have your people be able to see if you're in the area or if you're violating quarantine. We get into a range of things where there is by no means a consent. Are large numbers of Canadians that say, no, I'm really not on for that. Even the basic measures that have been in place to date, like maintaining social distance, people say, look, if that's going to go on indefinitely, I'm out. So we have a problem of how we move safely from this kind of, and I don't think anybody thinks it's a good idea to stay in our houses for the next 2 years or 18 months or whatever it takes to come up with a vaccine. So we have a real problem. We have to bring the public on side, and whether that's through a mixture of education, incentives, coercion, I don't really know the mix, but we better get that figured out because it's not going to work without compliance. And there's some evidence that there's some real areas of non-compliance emerging.
Frank Graves joining us on the Unpublished Cafe. He's the president and founder of Ekos Research Associates, and we're talking about the mood of Canadians and Americans, Canadians as well, talking about their mental well-being and in despair. We're 6 weeks into this lockdown, Frank, and I'm wondering, is possibly some of this despair because of a fear of the second wave or a second wave?
Oh, well, you should ask. I just asked that question of in a poll that is still in the field, but I have enough cases to answer. 90% of Canadians think there's going to be a second wave. Those half think it's going to be worse and half think it will not be quite as bad. But the idea that there's no second wave is something which is basically rejected. Most people say, no, we think there is going to be a second wave, which is probably not a bad thing because, unfortunately, it is risk perception which drives stress, which drives compliance. The people who are don't worry, be happy are the ones we're going to be a little worried about because they're the ones not really practicing the safe measures necessary. I would point out there are some positive things lurking in all of this, distress and fear and economic catastrophe. First of all, we've seen in our measurements that trust levels in institutions and professions have shot up. The levels of division and polarization that were occurring on partisan lines, they haven't disappeared, but they've certainly softened a lot. A conviction that public institutions are actually things which can be helpful when you run into big problems like this has seen a changed outlook on the role of government and public institutions. And there is some optimism that as we come out of this, most Canadians tell me we're not going back to the status quo. That's not on. And there's possibly we end up with a very dark future with some of the nationalist populism that emanated, for example, Europe in the aftermath of the Great Depression, or maybe we end up with some kind of a New Deal in Canada, North America, more akin to the New Deal that appeared after the Depression in the last century and ushered in the rise of the middle class and shared prosperity, and a lot of really solid improvements. So there is that sense that we might be on the cusp of a transformation, that this will allow us to do some things that otherwise wouldn't have happened. That's the more optimistic outlook. But there are some positive things out there as well.
How do Canadians see the pandemic as changing our society?
Well, there's a number of areas. I think we find the public, first of all, it has reinforced confidence in our collective ability to achieve things and in public institutions and government, that which were not in very good shape before. It has, to some extent, laid bare some of the social class divisions. People, for example, everybody knows that pretty well everyone wants to be working at home today. If you're not well educated and not a professional, though, you're not working at home because you have to go out to work and you're feeling more stress and risk and you're having a higher chance of getting this disease. The other things that are notable is I've seen, although the trust has gone up in, ironically, politicians has jumped way up. It was cartoonishly low 6 months ago, and all of a sudden there's modest levels of trust, but very high levels of trust in science, in public health experts, and doctors and nurses. And in general, this increase in trust is an interesting phenomena. We'll see if it persists if this thing goes on, or people, kind of tilt over from feeling extreme stress to feeling despair. The other I thought what's notable is it seems that this has almost been kind of a sea change in outlook on the role of the carbon-based economy. So when we look at the public and ask them where we should be investing as we move forward, there's almost no interest in investing in oil and gas, the automotive sector, or even airlines. Where people, I think, want to see investments is in a lot of things that are like healthcare, but also some of the things which involve transitioning away from carbon. So this may signal a period where people say, no, that's really not part of our future, and it might actually accelerate some of the impetus to move into other areas. I really I find it quite striking how much what a precipitous decline there has been in the idea that oil and gas are an important part of the economy and should be an important part for the future, because that wasn't only even a year ago or 2 years ago.
How long do Canadians expect the lockdown to last? Did you talk to them about that?
Yeah, I have. It's not just the lockdown. It's like, when do you think this is going to be over? And when do you think we can finally sort of go back to some sort of normal, or the economy will recover? When we started tracking, we've been tracking this daily really since the outset of the crisis. About 2/3 of Canadians said, 3 to 6 months, it'll be over, with, a fair number saying within 3 months. As this has gone on, the horizon has moved further and further into the distance, and the instance of people who think it'll be over in 3 to 6 months has dropped from 2/3 to about 20%. So a dramatic shift. The outcome, which used to be measured, or at the end of this, which used to be measured in weeks and months, is now, for many Canadians, being measured in years. And a significant portion, I think, it's never going to go back to normal or fully recover. But I would say the sense is now that most Canadians say it's going to be at least 6 months, and quite possibly 2 years before we really see a semblance of normal again.
Frank, I want to thank you for joining us.
My pleasure.
Frank Graves is the founder and president of Ekos Research Associates. Now it's your time to weigh in on our unpublished .vote question. How long do you feel it will take for the pandemic restrictions to be fully lifted in Canada? 3 months, 6 months, 1 year, longer than 1 year. You can log on and vote right now at unpublished.vote. Make your voice heard. I want to thank Frank Graves from Ekos Research Associates for joining us, and I want to thank you for listening to the Unpublished Cafe. Stay safe. I'm Ed Hand.